Question number 5. Of the Robson's classification, the 10 group classification system also that is called group 1 includes. Robson's classification is something we have discussed as professors and as consultants of institutes where we are teaching. We have discussed about this, and we know that it's a process of audit. It's a process of auditing cesarean sections in a hospital, and what are the indications in my hospital, what is the common indication in that hospital, what is the common indication, and then all the hospitals together of Delhi, they get together and they present their data to the government or for research purpose. So doing audit of cesarean sections, the Robson's classification or the 10 group classification system is used. This was first used in the National Maternity Hospital of Dublin in Ireland, and that was 2013, and then it was accepted by WHO as a recommended way of doing audit in cesarean section. Now, audit in cesarean section, audit in OBS and gynae is definitely a postgraduate topic and not a postgraduate entrance topic. That's what I feel. But things are, it is assumed that all the routine things you guys know very well. So that's why they are putting in questions like this. So yes, this is Robson's classification for audit of cesarean sections. And this is also known as the TGCS, 10 group classification system. In this, there are 10 subclasses, there are 10 categories. So what is the group 1? Group 1 is the Nulliparous Singleton who are undergoing spontaneous labor. So the answer is B. Now, let me show you, I'm just giving you the paper in which this study and this audit system was first published, and that is the International Journal of Obstetrics and Gynecology, and this is from the National Maternity Hospital of Dublin, Ireland. So the category 1 is Nulliparous cephalic, single cephalic more than 37 weeks in spontaneous labor, and Nulliparous single cephalic more than 37 weeks induced or cesarean before labor. So these are all the categories, all right. So the categories are here, and then this is the study groups, all right, of the number of studies which were done. Like in one study, it was seen that 146 patients out of 2040 were Nulliparous single more than 37 weeks spontaneous labor women, like that. This is the studies, and size of the group is mentioned next. Now, these are all the cesarean delivery in group as a percent. So in this group 7.1, and you can see 100% women had a cesarean when there was abnormal lies, whether there was a previous cesarean or not. All these women in this group had cesarean section 100%. But the sixth column is telling you that in all these patients who had undergone cesarean section, which one is the major most contributor for the cesarean sections? So this is that column, and this you can make out the biggest contributor for cesarean section is actually the previous cesarean section. All right, so this is how the audit is done, and this is how we represent our data across many hospitals, and then we come to a conclusion how cesareans are done in various institutes. A little tough, but then it is there in your exam, so now you have to know it. Okay, so this is the information which I gave you earlier, that now WHO has proposed this as a global standard for assessing, monitoring and comparing cesarean delivery rates within and between healthcare facilities.